doctor.
Hello.
How are you today?
I'm fine. How are you?
I'm fine, thank you. Today I would like to talk with you about the blepharoplasty. Can we start?
Okay.
Can you tell me what is cosmetic eyelid surgery?
Cosmetic eyelid surgery actually is a kind of procedure that we are regenerating, especially periocular, or in other words, around the eye area. So within this procedure, you are having a more youthful and more beautiful look.
According to the American Society of Plastic Surgery, eyelid surgery ranks among the top 5 most common cosmetic surgery procedures. Why it became so popular?
Because this area is the first area that we are looking when we met with someone new. Especially when we are meeting with new people, we are directly looking to the eye zone, this mid-face area. Also, because that we are taking lots of pictures and videos nowadays, everyone is checking this area when they are looking at our photos. So this area, it's become more and more important, especially to look more beautiful and more youthful.
How long does the blepharoplasty take?
It takes around the upper blepharoplasty around 30-35 minutes, and the lower blepharoplasty is around 1.5 hours.
Who is the candidate for a blepharoplasty?
A candidate for a blepharoplasty is a patient who is complaining about the odd look around the periocular area or around the eyes area.
Can I have blepharoplasty under local anesthesia alone, or do I need general anesthesia?
Both anesthesia is possible. I mean, you can have this operation with local anesthesia or with general anesthesia as well. But as a personal experience, I recommend to do it under general anesthesia, because during the local anesthesia, as it's the eye zone, the patient can be a little bit anxious and nervous. So I think, in my opinion, general anesthesia is better, much more easier for both for the surgeon and for the patient.
How long will I need to recover, and when can I return to normal activities?
After 1 week, the patients can go back to their normal activities, but during the first week, we recommend them not to read a lot or not to watch television or some movies a lot. So the first week they should rest a little bit.
Do you recommend botox after eyelid surgery?
Usually I recommend botox after this blepharoplasty or eyelid surgery, because the regenerating of mid-face zone area, it should be together with the blepharoplasty and the regenerating of this crow's feet around the eyelids. So we want to complete this regenerating after the blepharoplasty, and we are combining it with the botox, but not at the same time, usually after 2 or 3 weeks after the operation.
What is the difference between upper and lower blepharoplasty?
During an upper blepharoplasty, we are just taking out the extra skin, but usually during a lower blepharoplasty, we are correcting the fold which is happening under our lower eyelid, and also we are making the muscle tissue tighter. So anatomically they are a little bit different.
How do you decide whether I need an upper eyelid lift or a brow lift?
Usually an upper eyelid surgery is enough for many of the patients, but sometimes when the brow position is too low, we are also planning to do a brow lift operation as well. There are some different ways to do this operation, but it depends on the patient's eyelid and brow anatomy.
What is the age limit to undergo eyelid surgery?
There's no age limit, but usually we are doing the surgery after 35 years old.
Can any other procedure be performed at the same time?
Yes, sometimes we are combining it with brow lifts, or sometimes we are doing this upper and lower eyelid surgery with mid-face lifts.
Will I have visible scars after surgery?
Usually the scars are very, very invisible, but only the patient can see it himself or herself after the surgery, not by the other people.
What if I have had corrective vision surgery? Am I still a good candidate for a blepharoplasty?
Yes, you can still have the surgery, but we are recommending to pass minimum 6 months after a vision surgery, about an ophthalmic surgery. If you are planning to have a aesthetical eyelid operation, so we recommend you to wait minimum 6 months after your ophthalmic surgery.
What are some of the reasons an individual would choose eyelid surgery?
A youthful look and a better look, usually, not a tired look and a shining look. It's the keywords to have a upper or lower blepharoplasty surgery. Because usually these patients who are coming to our clinic to have this surgery, they are complaining about their friends or their family are telling them that, are you tired or didn't you sleep well last night? So they are looking a little bit tired or a little bit sleepy. Not because that they are sleepy or they are tired, because of the saggy eyelid. So this is the actually main reason that the patient are coming us and asking us if they are good candidates for this surgery. And after this surgery, they are feeling better and they are having better reviews, feedbacks from their friends or their family about they are looking more brighter, they are looking more fresh, they are looking not tired. So this is the good thing with this surgery, I guess.
Will eyelid surgery fix my peripheral vision?
Actually, there is no direct connection with the blepharoplasty and the peripheral vision, but sometimes because of ptosis of the upper eyelid, it causes the sagging of the eyelid if it's too much and it's causing negative effect on our vision. Then after this surgery, you can have a better view, but it's happening not for all the patients.
How long will my eyes feel tight after blepharoplasty?
Usually after 2 weeks or 3 weeks, the eyelids are becoming much more softer again.
When can I wear my contact lenses after surgery?
Usually after 1 week after the surgery, you can start to use your contact lenses.
Will I be able to read immediately after blepharoplasty?
You can read immediately after, as this surgery doesn't interact with your vision, eye vision. But we recommend to rest a little bit, especially during the first 1 week after the surgery.
How soon will I see the results? Are they permanent?
The results will be permanent, but don't forget that your aging process will continue and you will see the results even after 1 week after the operation.
What is the difference between upper eyelid surgery and so popular last time cat eye?
During an upper eyelid blepharoplasty, we are taking away the extra skin on the upper eyelid. But during a cat eye surgery, we are sometimes doing a brow lift or sometimes we are doing a canthoplasty for the lateral canthus. So it depends on the patient and the patient's anatomy.
Can eyelid surgery remove the wrinkles around the eyes, elevate droopy eyebrows, and take away dark circles under the lower eyelids?
It can help for some of the wrinkles, but not all of them. That's why we sometimes combine it with the botox. The color changes around the eyes, sometimes it can even affect in a bad way. So if you are complaining about the color changes around the eyes, we do not recommend always to have this blepharoplasty.
Will it make a difference if I lose weight before upper blepharoplasty?
No, it will not make a significant difference even if you will lose some weight before or after the surgery. Sometimes if you will lose a lot, I mean more than 20 or 25 kilos, then it can cause some differences, especially on the lower eyelid. But of course, your weight should be stable before and after the surgery.
If I'm unhappy with my results, or if I simply want another upper blepharoplasty down the line, is it safe to do another one?
Well, you should discuss it with your board-certified plastic surgeon. I'm sure that he or she will direct you to the right solution.
Thank you for your time today. Hope to see you soon.
Thank you too. Bye-bye.